Let me thank Errol Lewis and Harold Ford and District Attorney Rice and Ms. Robbins and Attorney Rubenstein and my good friend Clyde Williams for being here to do this opening panel.
Good morning, ladies and gentlemen. Thank you for coming out. It's good to see everyone. I always enjoy coming to this conference, and welcome to the first, I believe, of the breakout panels of the National Action Network National Conference. My name is Errol Lewis. I'm a writer for the New York Daily News, and I host a radio show here in New York City on WWRL Radio. We are going to explore the question, is the cost of health care killing us? We're going to look at this from a number of different perspectives. Each of the members of the panel are going to speak to you for approximately 4 minutes. I'll ask them a few questions as time permits, and then of course we'll open it up to you. And I think you'll be delighted. If you don't know all of these folks, you're really in for a treat. I'll introduce them from left to right. They'll speak in a different order. From my left, all the way on the end, Sanford Rubenstein is a partner at Rubenstein and Reinecke. He is a noted trial lawyer and most recently an author of a book called The Outrageous Rubenstein. If you know Sandy, you know that the title was, if anything, an understatement. Directly next to him, Clyde Williams is the political director of the Democratic National Committee, a man who'll be doing a whole lot of work. We probably won't see him between now and November 2nd, so get a good look at him now. And right next to him is Katie Robbins, national organizer for Healthcare Now. Harold Ford is the chairman of the Democratic Leadership Council and a proud New Yorker, I might add. He may have lived in some other state at some time, but he's a New Yorker now, and so we're glad to see him. Harold Ford is the chairman of the Democratic Leadership Council and a proud New Yorker, I might add. He may have lived in some other state at some time, but he's a New Yorker now, and so we're glad to see him. And next to him, the former Lieutenant Governor of the state of New York, Dr. Betsy McCoy, is a patient advocate and the founder of the Committee to Reduce Infectious Deaths. I'd like to continue with Katie Robbins, the national organizer from Healthcare Now.
Greetings, everyone. It is such an honor to be here to address this panel and the National Action Network. I know this is a room of people who love health reform, and so do we. In fact, we want more of it after this bill has passed. The title of the panel is The Cost of Healthcare Killing Us. It makes me see flashing lights and hear ding, 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 loud and clear. This is the problem our nation faces when it comes to healthcare, when we're number one in very few things but cost in our healthcare system. In overall health outcomes, we've been ranked at 37th. Tens upon tens of thousands of people die every year due to uninsurance, medical errors. As a 2005 study found that if disparities had been eliminated in the last century, there would have been 83,500 fewer deaths among African Americans alone. So what we've seen is a health insurance restructuring with this reform. And while some of the holes in the barrel have been plugged, a lot of the problems that we currently see in our healthcare system will persist. And for our organization, Healthcare Now, which was founded to support a social health insurance plan based on single payer financing and a single standard of high quality care for people, leaving about 23 million people out of our healthcare system doesn't fly. And the Congressional Budget Office did estimate that there would still be over 20 million people uninsured 10 years out from this reform. So we really see this as a significant event that happened. I think we need to separate politics from policy and have a real clear look at what this health insurance reform means and recognize that the battle, the struggle for universal high quality care in this country continues. I think it's really important to remember that. Ultimately, this reform had the wrong goals because we see a high-powered lobbyist effort controlling that congressional discussion. I mean, $220 billion were funneled into controlling the debate from the health insurance industry. I I mean, we saw $1.4 million a day spent so that their interests were protected. It was a massive, massive struggle. And then every dollar that we spend not going to healthcare, it's estimated that about a third of our healthcare dollar is wasted on anything but healthcare. We see it going to administrative costs, we see it going to profits, advertising, and every dollar that's wasted means that that's a lost resource to provide high quality, equitable care for all people. So we could have had a really authentic discussion looking at the kind of healthcare system we have. We have a Medicare plan, which is a single payer plan covering people over 65. Those with disabilities, we have the VA, which is actually socialized medicine, and of course our employer-based private insurance market. But unfortunately, that decision to keep the market-driven principles in place was made really early on, which skewed the discussion as we move forward. And we've got to be real about what this reform means, because until we as a nation decide that we're going to put health of people first before profits, we won't be able to achieve universal care or rational spending in our healthcare system. So what this reform will do, it does expand Medicaid to about 16 million more people. That is huge. It's going to put about $10 billion more into community health clinics. That is huge. It's also going to require those people who aren't eligible for public programs, Medicare, Medicaid, to purchase private health insurance. And I always say private health insurance is more like an umbrella that melts in the rain. You know, it's not there for you when you really need it. In Massachusetts, where they're experimenting with that mandate plan and have had it in place for about 3 years, there's 18% of people who have insurance and cannot afford to use it. Okay, so we're paying up to 10% of our incomes for premiums, and then when it comes down to it, we can't get the care we need when we need it. So again, I just want to conclude. The battle for universal equal access to care lies ahead. There is a remedy that is clearly in place in our Medicare system. We can look to that as a model that has been working, keeping administrative costs down to about 3% compared to the 30% in our private health insurance system. And we should recognize as the real goal to work for. We need Medicare Part E, an improved Medicare for everyone. E for everyone, right, friends? So by replacing the private health insurers, we could save $400 billion every year, enough to cover all uninsured people, upgrade everyone's health coverage without increasing our cost by 1 penny as a nation in what we spend on health care. So this law's shortcomings give us a lot of organizing to do on the ground, making sure that people get Medicaid that are promised it, making sure that the rate hikes that insurance companies are going to be trying to sneak by are protested, and working towards truly universal coverage. But I think that we've made significant progress in recognizing the government can do big things with the passage of this bill, and I look forward to working with all of you on getting the health care we need. Thank you.
Thank you.
You had mentioned that many people will be getting insurance that they can't use. And I'm wondering if this insurance is useless due to high copays or just specific illnesses that the insurances will not cover.
Well, it's similar to a lot of the same problems that we face with regulating private insurance. They're quite adept at avoiding government regulation. So what we'll see is an expansion of people who buy private insurance. But if we look to Massachusetts, where they've been experimenting with this, the copays and deductibles can be quite extensive in addition to their premiums. So people can spend 10 to 15% of their incomes on health care. And many times when they're experiencing health problems and they have a private insurance plan with these kind of burdensome, really significant choices being made between rent and food and paying insurance copays, we'll see people who will have insurance but unfortunately won't be able to use it when they need it, which is very problematic. And then insurance companies are also known for stepping in and intervening. We heard from Dr. McCoy about the threat of a government bureaucrat intervening into our healthcare, but we often have insurance company bureaucrats interfering in our healthcare system, right? So we'll have to be absolutely vigilant about making sure we hold the insurance companies' feet to the fire to be responsible for what they're being regulated for. And that is a real challenge that's on our shoulders because the government's going to have a hard time doing that.